Plan N is one of the most cost-effective plans that you can get. Let's find out how it works and let's find out what the benefits are. My name is George Ibanez. I am a licensed insurance agent, and my goal for this video is to explain to you exactly how the plan works and all the benefits that are associated with the plan. They are also guaranteed renewable, which means that for as long as you pay the premium, the insurance company will continue renewing the plan. They can't kick you out of the plan. They can't do any funny business with the plan. As long as you pay, they will continue providing you the services, unless the company, of course, goes out of business, and then you will be transferring your benefits to another company that you need to apply to. But under normal circumstances, everything will be 100% the same. Now, the prices can go up just like any company you select. It doesn't matter which Medicare supplement company you select. But your prices, it's the only thing that will change. And over time, they will go up just like any other insurance company. However, the benefits will stay the same unless Medicare changes the deductible and something like that. But aside from that, everything will stay the same. On the Plan N, you will have an annual deductible of $240, just like you would on Plan G. However, on the N plan, you will have a couple of copays. You will have a $20 copay for doctor's office visits, and it doesn't really matter whether it's a regular doctor or if it's a specialist, you still will have a $20 copay, and you will have a $50 copay for the emergency room. Now, you will be responsible for excess charges, if any, if your doctor charges excess charges to Medicare. However, most doctors do not charge excess charges, will not charge you excess charges, and I believe the last time that I checked, only about 2% of the doctors, actually it was under 3% of the doctors are currently charging excess charges, which is a very small amount of doctors. Consider the amount of doctors that are available in the US. Now, excess charges means that if the doctor is not contracted as a provider with Medicare, he can charge you up to and not to exceed 15% of the normal and standard charges that he or she charges. However, that number of doctors that do that, it is absolutely insignificant. And most doctors, you're going to find out that they do not charge that extra 15%. No, can you bump into a doctor that happens to charge 15% extra for his services? Sure, you may find that out. Although even if they do charge 15%, normally it amounts to a very small amount, which it may be $9, $10, $20 max. And they are also supposed to disclose that information upfront, and in many cases they have to post it in the lobby and let you know before they charge that. As far as hospitals go, I have not encountered a hospital lately that charges any excess charges, including Mayo Clinic that used to do that. I believe they no longer charge excess charges. Most of these doctors that charge you for excess charges do not have a contract with Medicare, which means Medicare will not be doing the billing on their behalf. So you're going to find out very quickly if somebody charges excess charges or not, because they're going to ask you for your credit card up front in order to charge you for that 15% extra that they will not get with Medicare. That's a great way to find out whether they're going to charge you or not for the excess charges, since you will find out up front, and at that point you will have the option to go there or to find yourself another doctor. But again, a very small amount of doctors charge excess charges. Now, if you want to find out for sure if the new doctor that you're going to charges excess charges or not, there's a very simple way of doing that. All you have to do is go to Medicare.gov, look for a list of the doctors, and if you find your doctor that you're looking for and has a red question mark that says he may charge, and the word is may charge, and I'm going to read you the word. It says may charge the Medicare approved amount. That means that they may or they may charge you more. So look for that little red question mark and see if he has that. If he has that, then you can question the doctor. You can ask him if he charges excess charges or not, if you were to have a Medicare Plan N, because if you had a Plan G, it doesn't really matter since they pay for that. But if you want to know for sure, you can go to Medicare.gov, look for the list of providers, and it will tell you right there and then if the doctor has been contracted with Medicare and if he charges excess charges or not. Now, to finalize the excess charges discussion, you will also find out that most doctors, if not all, they post that type of information saying that they're not a Medicare provider and they do not do Medicare billing, and they normally post that in their lobby and in their window when you go to pay for anything. So you will really know up front if they do or if they don't. As far as hospital goes, I'm not aware of this at this time. Of course, I cannot be 100%. There may be some oddball hospital that does, but at this time, I'm not aware of any hospital charging excess charges. Is it a possibility? Sure, but not likely, and I'm currently not aware, including Mayo Clinic, that used to charge for excess charges, but they no longer do that. Additionally, if they would take you to an emergency room, for example, even if you didn't have a Medicare supplement, if you have a Medicare Advantage plan, and you happen to be taken by an ambulance and they take you to an emergency room, to a hospital that is not part of the network if you had an Advantage plan, because with a supplement there is no network. But if they happen to take you to an emergency room in a hospital and you have a Medicare Advantage plan, there's no such thing as out of network emergency rooms. So if they take you to the wrong hospital, if they take you to the wrong emergency room, even if it's out of network, you will not be charged out of network rates for whatever services they do to you. Personally, I think that Plan N is the best value out of all the Medicare supplement plans. If you consider that they have the lowest premium out of the full benefits Medicare supplement plan, and the only charges that you pay out of pocket is your $20 for your doctor office visit and the $50 for the emergency room. And if you consider that most Plan N's compared to Plan G's will save you anywhere between $30 a month to $60 a month, and most people do not go to the doctor 24 or 25 times a year, but even if you would, if you look at the savings, it will save you more money if you go with a Plan N than if you go with a Plan G, unless you're going to the doctor every day of the week. And then at that point, obviously the Plan G would be a better plan since you wouldn't have to pay the $20 copay. But for the average person that goes normally to the doctor 2, 3, 4, 5, a half a dozen times a year, the Plan N is still a much better value than any of the other plans. Now, if you want to play safe and you don't want to deal with copays, you don't want to deal with excess charges, and you don't want to deal with anything, then you can go with a Plan G. Plan G is a phenomenal plan. It's going to cost you more than Plan N, but it is a hassle-free plan. So if you don't care about the savings of the money and you don't want to deal with copays or anything of that nature, then I would say go with Plan G. But for the average person, Plan N it's a fantastic deal compared to any of the other plans due to the benefits and the low cost of the premium. If you enjoyed this video and you got some good information out of it, please like and subscribe. And if you have any questions, leave them to me in the comment section and I will try to get back to you as soon as possible. Or give us a call or email us at the number below.